Welcome to today's National Organisation for Fetal Alcohol Spectrum Disorders webinar. For technical assistance, please phone Redback Support on 1-800-733-416. If you would like to listen to this webinar via the phone, the dial-in number and passcode is listed in the chat box. Our presenter for today is Anne Heath. If you would like to ask Anne a question at any time, please do so by typing it in the chat box, which is located at the bottom left-hand side of your screen, located to the right of the cogwheel. I'll now hand you over to Anne to begin.
Thanks, Jeff. As always, it's wonderful to see so many people from across the country and maybe even across the world being able to tune into this presentation. Technology is just wonderful because we can connect from so many remote places, and hopefully there won't be too much on in the background that may interfere or you may hear. If that's the case, hopefully you won't hear too much. And as Jeff said, please, if you have any questions, write them down in the chat box. I'll attend to these at the end of the presentation, but some of your questions may also be answered as we go through. And to begin with, I'd like to say that NOFASD Australia seeks to be inclusive, consultative and authentic in its engagement with and recognition of the traditional owners of Australia. NOFASD Australia is a national organisation and therefore acknowledges all groups of traditional owners on whose land we meet today, regardless of whether the meeting is face-to-face or created through technology such as this. NOFASD Australia respects the unbroken ownership and cultural expressions of Australia's traditional owners, which reach beyond all recorded history in the world. So a little about NOFASD for those of you that may be new to us or may not have heard of us before or attended one of our presentations. We were established in 1999 to represent the interests of people and families living with fetal alcohol spectrum disorders in Australia. We're the essential bridge between researchers, clinicians and those with lived experience. And we're now the national peak body working towards influencing policymakers and medical professionals for the rights of individuals with FASD and the rights of their families. Our vision is the prevention of alcohol-exposed pregnancies in Australia and an improved quality of life for those living with FASD. Incorporated in 1999, this is the work that NOFASD Australia delivers. We deliver support services, both online and telephone inquiries, and advocacy through consultation. We deliver community engagement, which is applying a community development approach because communities are unique and diverse, and this is where changes will always happen. We try to influence policy and advocacy because we represent the interests of those living with unrecognised and unrecognised FASD. We provide education and training to the service provider sector such as this because this is where the most need is, and unfortunately where some of the biggest barriers to understanding FASD as a brain-based condition is. We develop partnerships because we only have a very small staff team with just over 2 of us, equivalent staff, which means we can't meet the demand, and because we're positioned as a problem in Australia and we need to get on top of that and develop partnerships that will also help influence that. And finally, we're involved with research because we must ensure that research should inform and improve the lives for those who live with and are affected by FASD. This presentation will meet a number of objectives. So by the end of the session, you should have a knowledge of what FASD is and some of its signs, how it affects the individual, and we'll also address some of the most common misconceptions about FASD. We'll look at 5 myths today around who's at risk and alcohol, IQ, what FASD actually looks like, and myths about there being a cure. And we'll finish up with some things that you can do as someone who may be supporting or living with someone who has FASD. And please be aware that these myths that we're going to talk about today are not the only myths out there. They're just some of the common ones that we have time to look at today that come up quite often. There are so many more of these, and if you need more information on any of today's, or if you want to research other myths, please head to our webpage and have a look. So firstly, what actually is fetal alcohol spectrum disorders and what causes it? We'll have a look at this before going into the myths. So there are a number of conditions that can be caused by the developing fetus being exposed to alcohol. These can be both physical and neurodevelopmental. And quite simply, FASD is the term that we use to cover all of these possibilities. Overall, FASD is now one of the most serious harms caused by alcohol, from the time the child is conceived right through to death. This means beginning life with complex needs, and that responding to this problem means we must think about FASD for children, adolescents and adults. FASD can be prevented, but at the moment in Australia, it's the leading preventable cause of non-genetic disability. And there are more FASD sufferers born each year than all sufferers of autism, spina bifida, cerebral palsy, Downs and sudden infant death syndrome. And because it's so prevalent in Australia, it's a very serious public health issue. FASD can be difficult for practitioners to distinguish from other developmental disorders since they share similar learning and behavioural problems. As a result, FASD is often misdiagnosed, so the treatments and recommended strategies don't always work effectively. In the diagnosis process, it's important to try to find a practitioner who's knowledgeable about FASD so that the correct diagnosis can be made and the recommended treatments are more likely to work. If you don't already know who these are or haven't found them already, NOFASD Australia can help you find those practitioners, so just give us a call. So the effects of alcohol on the fetus. An adult healthy liver can metabolise about 1 standard drink of alcohol in 1 hour. So for an unformed or unhealthy liver, it can take much longer for the body to free itself of alcohol. And this can be when FASD starts because the alcohol affects the developing brain of the fetus. Damage can occur at various regions of the brain. The areas that might be affected depend on which areas are developing at the time the alcohol is consumed. So in these post-mortem photos, you can see the difference between the developing brain on the left without alcohol and the brain on the right that's been subject to alcohol. These are extreme cases of a 6-week-old baby that has a normal brain and a 6-week-old baby that has a FASD brain. Not all brain damage is seen on brain scans, as lesions might be too small to be detected, yet large enough to cause significant disabilities. This is an extreme example again of what may be seen on scans where prenatal exposure to alcohol has been significant. You can see that the child's brain on the right has a smaller head. The surface of the brain is also a lot smoother and there are fewer folds in the brain. The face appears much flatter and the inner structure of the brain has also not developed properly. Some of the signs of FASD include these. FASD children often grow different to others. They're often slower in growing and smaller overall. And that may be one of the first things that someone may notice. And there's also likely to be other physical abnormalities, and those aren't always seen. So, for example, ears may be misformed, and if you can see, they may be placed lower on the head than what you would expect. You may also notice that the child has difficulty seeing or hearing. They may talk later than other children of the same age, or have problems understanding what they're being told. And they're likely to struggle with writing and problem solving. Other signs as the child becomes older may be that they're more trusting towards others than you would expect. This can often lead to negative situations like scapegoating as well. They may not be able to concentrate for very long on one activity. They may be highly active and may be impulsive. And this may result in poor relationships with others, particularly peer group, which causes them to become socially isolated. So they'll often prefer to play with younger people or younger children. And this is an example of what FASD may appear to be, especially someone that is educating or working with a child that's suffering from FASD. So your typical 5-year-old will go to school and follow probably 3 instructions. They'll play with others and take turns, and they'll probably be able to sit still for about 15 minutes. But a 5-year-old with FASD, they'll need to take a nap. They'll follow 1 instruction if you show them. They'll probably only be able to sit for about 5 minutes and they'll want to play on their own. So they'll act more like a 2 or a 3-year-old. Your typical 10-year-old will stay focused for about an hour, and they can read and write fairly fluently, and you can give them a worksheet that they can learn from and read. They get along with others and they'll play with their friends at recess, and they have a lot of energy. But a 10-year-old with FASD will only pay attention for about 10 minutes, and they're still learning to read and write. Instead of being able to learn from worksheets, they'll still need to be able to see what they're doing and experience what they're doing to be able to learn. And they'll become easily tired and overwhelmed. And they'll act about the typical 5-year-old. And this is because one of the challenges of living with FASD is that individuals function at a much lower age and at different ages. So a 25-year-old adult living with FASD may actually be functioning as a 15-year-old. So they'll prefer to spend time with 15-year-olds. And to others, it will look like the child or the individual is distracted or confused, not following instructions from parents or carers or support workers or teachers. They may be irritated, impulsive or throwing tantrums, and they'll repeat the same mistakes. They don't recognise danger, so they're likely to engage in risky behaviours. They'll be unsure what's fantasy and what reality is. And as I mentioned before, they'll follow their peers into both good and bad situations and decisions. So quite often they can be used as scapegoats. So now we'll look at some of the myths associated with FASD. And the first myth is that FASD only affects particular cultures or communities. This is actually the easiest myth to put to sleep. Put simply, FASD does not discriminate in any way. And I can't stress enough that any woman who drinks alcohol during pregnancy at any time during the pregnancy can put their unborn child at risk. That's any woman in any society from any socio-economic background where alcohol is available. Any woman can put their child at risk. In the past, people have tried to point fingers at particular cultures or particular groups in society, but it doesn't discriminate against anyone. Everybody is at risk. And unfortunately, the first thing a mother does when they find that their child has FASD is to blame themselves. And by pointing the finger at groups of people, we're actually reinforcing that blame at a time when support is most needed. We know that no mother intentionally tries to harm their unborn child. FASD is simply the result of a lack of knowledge around drinking while pregnant. And if this information isn't shared, those who are planning to become pregnant are more likely to drink in that vital time when the central nervous system of the child is developing. So people out there, if they enjoy a drink and they've not heard of FASD and suddenly realise they're pregnant because it's not been planned, their chances are increased. So this too is fairly simple. No amount of alcohol is safe to consume at any time when planning pregnancy, when pregnant or when breastfeeding. The myth is it's okay to have a couple of drinks when pregnant. The fact is it's not okay. And this is why. This slide displays the risk of the developing fetus across the whole gestation. So consuming alcohol at any stage in any amount has the potential to cause harm all the way through till the child's born. The dark green areas denotes the highly sensitive period. And note that the central nervous system is developing from the 3rd week of pregnancy. And the brain is in the 20th to the 36th week of pregnancy. So what happens when alcohol is consumed prior to confirmation of pregnancy, which may not be until around week 5 or week 6? All the brain and central nervous system, the skeletal and major organs, the ears, the eyes, the palate, the genitalia, these can all be affected before a woman even knows that she's become pregnant. So the safest way to avoid FASD is to simply not drink alcohol when planning a pregnancy, during a pregnancy, and it's recommended not to drink also when breastfeeding. So in effect, the only cure is not to let it happen. Myth: individuals with FASD have a low IQ. Quite often, because individuals with FASD are considered intellectually disabled, it is also assumed that they have a very low IQ, and this is one of the biggest myths involved with intellectually disabled people, FASD children as well. So a couple of facts about IQ is the average IQ is around about 90 to 110. And if it's below 70, you're considered to be mildly intellectually impaired. And the actual facts are 73% of those with FASD have an IQ somewhere between 70 and 120. So they're not terribly intellectually impaired, and some are well above average. Only approximately 27% of individuals with FASD will have an IQ below 70. So the other remaining 73%, nearly 3/4 of those living with FASD, have an IQ range from the low to the high average. But well, the IQ is a measure of an individual's overall intellect. It's not a measure of the individual's ability to function in society. To measure someone's functioning in society, all domains of brain functions need to be assessed separately. And this is especially so for executive and adaptive functioning, because these appear to be universally impaired in FASD sufferers, regardless of the level of IQ. Executive functions are about being able to plan, learn from experiences, and have impulse control. And the part of the brain responsible for executive functioning is the prefrontal cortex, which is the forehead. This part of the brain generally forms poorly with FASD. And what the damage looks like will be different from child to child or person to person. Each person living with FASD will have different challenges in daily living, learning, and how they behave regardless of their IQ score. And to demonstrate this, dysmaturity is a classic sign of FASD, and it's a critical concept to understand when supporting someone who is living with FASD, and also relates to earlier when I was talking about how different ages may act a bit differently. A 10-year-old may act more like a 5-year-old. It's because of this dysmaturity. So you may be working with someone or caring for someone who appears to be acting like 6 years old, 8 years old, 11 and 15 all at the same time. So they can be 6 years old socially, 8 years old emotionally. Reading ability can be around 11 years old, but they can actually be 15 years old. And this can be so confusing and frustrating for parents or carers or teachers because they seem to be so many different ages and they can't pin down one particular ages. And IQ can have some, a lot, or no effect on these different areas. Similar to autism, a person living with FASD is likely to be extremely good at something. And this is where IQ can also be evident, or again, not in some cases. These positives can actually be far more positive than would be expected, whether it be in creativity or athletics or music. It's just so vital that these strengths are recognised, nurtured and developed. They too can often mask some of the severity of other symptoms too though. So it's important to be aware, even though these positives may be immense, they can also mask some of the other symptoms. Protective factors are things we can do to help a person living with FASD to avoid secondary conditions, and so we can nurture the positives. So first up, finding a medical practitioner early who can diagnose FASD can have so much of an impact. And then linking into community supports and education supports where available, and be able to provide a stable, understanding and nurturing home without trauma. All of these can allow us to be able to support the positives and nurture the positives rather than allowing negatives to overtake the situation each time. Another one of the big myths around FASD is we can see FASD because of the facial features. And sometimes we can see FASD, but it's vital to remember that we can't always see FASD. And this is why it can be so difficult to diagnose and why there are so many diagnoses that are incorrect. The myth is that FASD will always have facial features, and this is the most severe form of FASD, but it can cause confusion and erroneous conclusions, because only 10 to 15% of those diagnosed with FASD will actually have the facial features. So only 1 in about 10 will have facial features. The rest we will not see. And this is where we can talk a little bit about the criteria for FASD, because there are two types, and to meet a FASD criteria, both require severe impairment in at least 3 of these domains. Visible differences are only part of the diagnosis and not necessarily a criteria for diagnosis. So executive functioning includes impulse control and hyperactivity, and adaptive behaviour includes the social skills and social communication. The other domains are memory, motor skills, language, cognition, attention, academic achievement, affect regulation, and brain structure, which is neurology. So there has to be severe impairment in at least 3 of those domains. So FASD with less than 3 of the facial features are the highest risk of misdiagnosis. This disorder is often put down as the child's behaviour rather than a disability, but visible features such as facial features are not always present. The diagnosis process will confirm that the mother consumed alcohol during pregnancy, and it will confirm that there are severe impairments in at least 3 of the neurodevelopmental domains. But there will not necessarily be any facial features. Unfortunately though, this is absolutely no different to how severe the dysfunction in the brain is, regardless of what we can or cannot see. The diagnoses have different criteria, but all are the same in that they have some kind of brain damage. The diagnosis that most people are familiar with when they know a little about FASD is this one, where there are the 3 sentinel facial features. And this is usually caused when alcohol is consumed by the mother on the 17th to the 20th day of pregnancy. And because there are visual differences in the face of the person who meets this criteria, it doesn't need to be confirmed that the mother consumed alcohol. But again, there are always severe impairment in at least 3 of the developmental domains, and that is what counts the most. So yes, there is a FASD that you can see, but not always. In this picture, you can see a child that has fetal alcohol syndrome, and you can notice that they have small eyes, a smooth philtrum, which is the area between the nose and the upper lip, and a thin upper lip as well. Children with FASD can also have a flat mid-face, which is across the cheeks, the nose area. They can have a small head circumference, which is the measurement around the head. This child also has the low set ears that I mentioned earlier. Sometimes they can have a small or not completely formed chin. And there may also be some kind of malformation with the hands or fingers. And this picture summarises the main features. And this is an older child. There's skin folds at the corner of the eyes as well that may be apparent. And small eye openings. The nasal bridge, the bit where your glasses usually go, will be a little bit lower. It also shows the mid-face that's flat or small. A nose that may be a bit short. And the head appears smaller as well. So, assessing the possibility of FASD requires a multidisciplinary team because it's not something that can simply be seen. There are a small number of specialists and FASD clinics currently operating in Australia that have multidisciplinary teams that can conduct a diagnostic assessment. However, these clinics are few and the teams are not always available. So assessments can be conducted across a range of clinical settings over a lengthy period of time. If you're interested in where those clinics may be, please get in touch with NOFASD because we keep a lengthy database of who's working in what area at what time, who have specialisations within FASD. And another myth, in a medical sense, FASD cannot be cured because parts of the brain and its neurons simply do not form. A cure actually means to restore health, so to put something back into its working condition that it was originally. But we cannot restore something that did not exist or develop in the first place. In the case of FASD, some of the neural connections do not grow. It's not that they're able to be restored because they didn't exist to start with. To explain this a little further, alcohol is what's called a teratogen, which is something that can cause an embryo to not form correctly. Alcohol also alters the structures of cells, reducing the ability of nerves to correctly function. And this is because the insulating layer of fatty tissue around some nerve cells and interconnecting cells don't develop properly. This is called myelination, and if the fatty tissue doesn't grow, the cells cannot communicate. So the central nervous system will be unable to function at the speeds it would normally function at because the fatty tissue is like an electrical conductor. If it's not there or if it's damaged, information speeds can slow down or not even happen. So think of the cells or the nerves in the brain as electrical wires with plastic insulation. The myelin, or the fatty tissue, is the plastic insulation. This doesn't grow properly and leaves the nerve cells or the electrical wire exposed. And no, I'm not an electrician, but most of us would know that most wires that are exposed can be very unpredictable. And those with FASD can also be unpredictable in their behaviours. So alcohol actually causes trauma to the developing fetus by poisoning the cells of the brain that is within the developing fetus. And often you hear how some organs can fix themselves with time and with removal of toxins. For example, you very often hear people say if people stop smoking, their body immediately starts to repair themselves. And this is not the case with brain development because the damage has been done at the time the brain is actually forming. So ultimately, the effects of prenatal alcohol exposure cannot be cured, so FASD cannot be cured. There isn't a cure, but of course we can do a few things to ease the associated problems. Just as with any other disability, even a physical disability, the FASD condition also needs environmental accommodations. It may not be as obvious as some other physical disabilities, but the impact can be just as significant on the person that has FASD. So, by understanding how alcohol affects the fetal brain, it's possible for a high quality of life for those living with FASD. And another myth. At this stage, FASD is not recognised as an intellectual disability, but be assured that NOFASD Australia are working very hard to change this. But because FASD is not recognised as a disability, we often hear people say, so even if I do get a diagnosis, it's not going to make a difference. But that is certainly not the case. There are different ways of working with individuals depending on their disability, of course. And a correct diagnosis means that not only are we able to work with FASD individuals and their families, but others as well in a way that best suits the individual. We also know that much of the medication prescribed for other disorders doesn't work for FASD individuals. So a good diagnosis will also mean that any medications prescribed are suitable. It means that those who have increased knowledge, like parents and carers and clinicians, are also in a better place to advocate for those living with FASD. And there are many FASD services out there, and some medical professionals. A correct diagnosis means that access to such services become available when they may not have even been considered previously. We've already established that IQ is not always a factor with FASD. And those living with FASD can suffer many difficulties because of frustrations or sadnesses being associated with and being aware of their condition. There's a real fear for those living with FASD that they don't live up to the expectations of others. And this can lead to a number of associated problems, which are called secondary disabilities, which are also more likely with incorrect or not being diagnosed at all. So these are the kind of things that can result, and just some of the examples include using illegal drugs or relying on alcohol, depression and anxiety and dropping out of school, being suspended, breaking the law. And many of you are aware of these things. All of that stuff can lead to poverty and homelessness, anger and aggression, isolation, early parenthood, and poor self-esteem. So having a good diagnosis can also mean these secondary concerns are not so much of an issue. So ultimately, this means a good diagnosis means less chance of alcohol and substance abuse, less chance of disrupted school experiences, a reduction in inappropriate behaviour, and less chance of mental health issues. And so often, a child with FASD will be seen as the naughty kid. For example, most see children as naughty if they do not do something, or they have a tantrum, or they misbehave in any way. A diagnosis can help here too, because with FASD children, it's more likely that they can't do something and can't express that they can't do it, rather than that they won't. And remembering this kind of thing takes practice, because it's much easier to consider a child that's playing up to be a naughty kid, rather than questioning, how can we help? So sometimes we need to think and work a bit differently, and we wouldn't even consider that if we don't know about FASD and there hasn't been a diagnosis. It's human nature to blame bad behaviour on naughty kids or bad people, rather than seek information on how we may be able to do what we're doing a little bit differently. And here's an example of some of the things that we generally see, particularly as a person with FASD is progressing through school. On the left is what we see when we deal with challenging behaviours. But on the right is what a child living with FASD may actually be experiencing. So we might see a bad child acting up. To the actual child, they're frustrated and defended and challenged. We may see them as being lazy, but they're actually trying really hard. We may think a child is lying, but a FASD child is probably trying to fill in the gaps. And when they're not trying, it's probably because they're exhausted, because they've tried so hard and they keep failing. Quite often, they will become defensive, hurt and abused, and that will look to us like they're being mean. And when we think they're refusing to sit still, they probably can't identify or show how they're feeling. It's not that they're resisting, they just don't get it sometimes. And when they can't remember, they're not trying to make you mad. So we need to seek to understand rather than just see. And here are some more examples. We see kids that won't or don't, or attention seekers, or acting like babies, or stealing, or being inappropriate. There are so many other ways to understand this with FASD. So having a diagnosis can make the world of difference for a child in so many positive ways. And it links the parents and carers with the right supports. And with the right supports, the quality of life for those living with FASD can be significantly improved. So, some things you can do. So if you're caring or working with or know someone who's living with FASD and you're interacting with them regularly, ask yourself these questions. Who is the person? What strengths and abilities do they have? What challenges might they be having in their life? What part of the brain injury plays a part in the behaviour and the management of the situation? And are the behaviours actually primary, so something because of FASD, or secondary, something caused by FASD? And these, think about the feelings and behaviours you bring to the interaction as well. Are they negative or positive? And what would the person with FASD think would actually help them in the situation? Ask them what would help. So always keep in mind that it's not that they can't do something, and it's not that they're naughty. It's they struggle, and be realistic in what you expect of them. Try to accommodate these and social and environmental barriers as well. And even though you may see extreme strengths, if we're going to nurture them, we also need to keep in mind that difficulty understanding that actions have consequences. There will be short-term memory problems and developmental delays. There will be difficulty setting goals and keeping on track. So to improve these kind of things or help with these kind of things, rehearse, 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 or repeat, repeat, repeat. Sometimes you will need to repeat yourself over and over again. But the more often you do that with the less frustration and aware that you need to do that, the more likely it will be to assist. Be very simple in what you ask or require, and creative as well. You may not be able to provide the child with something to read. You may have to show them how to do something. And ask them to repeat what you've said in a different way, like paraphrase, just so you know they've understood what you've said. And here's some more ideas, like learning must be relevant. If it's not relevant to the child, they're not going to take any notice. And build on strengths. Always praise and encourage when something goes right. Try different things until something works. And talk to others. If you're a parent, talk to the school. If you're the school, talk to the parent or the family. Try not to get the person with FASD or the child with FASD in things that will take a long time to do or be excessive, and always help them when they need the help. And finally, be honest with yourself. Working with a child with FASD will be challenging, and you need to be able to admit this to yourself and have someone else to talk to. And that's where we can help too at NOFASD Australia. We can help you develop a plan to be able to absorb the emotion of it all. We listen and offer support. If we can't help, we'll find something that can and someone that does. So our website is loaded with numerous resources, and if there's still something there that you can't find, we'll find it. And sometimes it can be useful just to talk to someone that's in the area. So There's so many things our website or our phone calls can offer, so please don't hesitate to get in touch. So I would like to thank everybody for attending today, and I notice that there's no questions, so we will end it there. But as I said, after today, if you think of something that you would like to ask, don't hesitate to get in touch with us at any stage. And I think everybody will get a copy of this through their email as well, so you'll have access to the slides and our details as well. So we'll end it there. Thank you everybody for attending. Take care.